Good afternoon, listeners. Thank you for joining us at today's Healthy Community. Our show airs weekly on Fridays from 12 to 12:30. Today's Healthy Community aims to improve health literacy by offering resources and information that strengthens and supports the wellness of individuals, families, and the communities in which we live. Today we have a very special guest, Dr. Lucinda Miner. She's with the National Institute of Health. And first and foremost, I want to say happy birthday to you, Dr. Miner. I know that you're
thank you.
On this trip around the sun. I really appreciate you joining us today to share your thoughts on so many things that are affecting our country and our state in regards to health care. I'd like to give a little bit of background on Dr. Miner. She's currently the Deputy Director of the Office of Science Policy, Engagement, Education, and Communications at the National Institute of Health's National Heart, Lung, and Blood Institute. She works to help develop and provide accurate science-based information to help ensure that research is both useful and used. Prior to joining the NHLBI, National Health, Heart, Lung, and Blood Institute, she was the director of the Division of Scientific, Regulatory, and Health Communications at the Federal Drug Administration's Center for Tobacco Products. In that role, she spearheaded the center's effort to educate the public on the role of the Center for Tobacco Products and help protect the public through regulation and education on the dangers of tobacco products. She joined CTP in January of 2011 and became their first Associate Director for Science Communications. Dr. Miner started her public service career at the National Institute on Drug Abuse, an intramural research program, and established the Institute's first molecular genetics research lab. She eventually transitioned from lab science to science policy and communications at the NIDA, eventually becoming the acting director of NIDA's Office of Science Policy and Communications. Dr. Miner received her PhD in psychology and behavioral genetics from the University of Colorado. She completed postdoctoral training at the University of Minnesota and the University of Pittsburgh. She is the author of numerous scientific articles and chapters on genetic underpinnings of addiction. Dr. Miner served on a number of federal task force and committees and has received numerous awards and honors for her leadership in setting science policy standards and cutting-edge science communication efforts, including sharing an Emmy Award for her contributions to the HBO documentary Addiction in 2008. So you are like a rock star on the stage of healthcare, and I will say that you are a wealth of information on addiction and have so much to offer in regards to that very troubling and challenging topic that faces communities and neighborhoods and families all over this country. So I would like to welcome you back for an episode on addiction. But first, let's talk about today's topic, the National Institute of Health. And I know that it is Heart Health Month, so I think this is very appropriate. Dr. Miner, can you just, a lot of people, healthcare can be very confusing, and there's a lot to understand and know. And the National Institute of Health is such a large organization. Can you tell us a little bit, help our listeners understand exactly what the National Institute of Health is?
Great. Thank you. First, thank you for the wonderful greeting, and I can't think of a better way to spend my birthday than to be talking with you, and hopefully people will learn a little bit more about the NIH where I work, and then also see us as a really useful resource for lots of information about all things related to health. But specifically, what is NIH, or the National Institutes of Health? We are the largest public funder of biomedical research in the world. Our research is aimed at enhancing health, lengthening life, and reducing illness and disability, not only in this country but around the world. And we achieve this mission really by supporting and conducting cutting-edge research to improve treatments and prevent disease and expand our knowledge of really the basic biology, behavioral and social underpinnings of health and disease. NIH, and I say it's the National Institutes of Health, plural, because it's a really complex organization. We actually consist of 27 different institutes and centers, and each one of these institutes has a focus on a specific research agenda. So, for example, some of the institutes focus on a particular disease. You may have heard of the National Cancer Institute, which is part of NIH. Or other institutes focus on body systems, like the one I'm at, the National Heart, Lung, and Blood Institute. Given its name, you can kind of figure out that we focus on heart, lung, and blood, as well as sleep disorders.
Yeah, that's interesting. Tell me a couple of other bodies or entities under the NIH that besides the National Cancer Institute and the National Heart, Lung, and Blood Institute that are umbrellaed with the NIH.
Yeah, well, you already mentioned one that in my bio, the National Institute on Drug Abuse, which I worked there for a number of years, that focuses on how drugs work in the body and the brain and what are the underpinnings of addiction. We also have the National Institute on Mental Health. As its name suggests, focuses on how to maintain mental health and has a specific interest in looking at various psychiatric illnesses such as depression, anxiety, schizophrenia, etc. There's the National Child Health Institute that focuses on, childhood development and all of the diseases that can come along with that, but also what are the normal aspects of child development. What else? The National Institute on Neurological Diseases and Stroke, looking at how the brain works. And we also have the National Institute of Aging that looks at the aging process in adults, and then they have a particular focus right now on Alzheimer's disease and dementia and cognitive decline as you age. So really the NIH is just, it covers the lifespan, it covers all of the body functions. I mean, it really touches every aspect of us as individuals.
And as we move forward, and I think our listeners would be keen to and appreciate the opportunity to learn more about the NIH, they can go to the internet and visit the NIH website and look at the different departments that are umbrellaed by the NIH and see things that may be of interest to them.
That's right. At www.nih.gov, that'll get you into the main site, and then from there you can find links to all the various institutes. And there are just lots and lots of resources there for the general public, for students, for healthcare providers, for people that are interested in research. As I say, the main thing that we do is support research. So all of the resources we have, actually 90% of them go outside the NIH or to academic institutions across the country to support research in all of the various aspects that NIH is interested in. So if you're interested in doing heart disease research, for example, you would apply for funding from us.
That's terrific. What a great resource and what a great way to support us moving forward in a new light of healthcare delivery. So at the National Heart, Lung, and Blood Institute, you do a lot of work there. I know it's a large part of the National Health Institute. Can you speak specifically a little bit about the National Heart, Lung, and Blood Institute?
Yes, absolutely. NHLBI, I'll lapse into government acronyms, but if you need a clarification, I'm happy to give it. The Heart, Lung, and Blood Institute. We're actually the third largest of the NIH institutes. We have a $3 billion budget. So we support and conduct research on heart, lung, blood, and sleep disorders, aimed at ultimately developing more effective treatment and prevention approaches and ultimately to improve public health. One of the things that I really like about this institute and my passion is that we understand that doing good research is not enough, that if we're really going to have that impact on public health, we need to make sure that that research gets out there in the hands of people who need it, those who use it, such as healthcare providers, but also the general public, so that they can understand more about what to expect when they visit a healthcare provider, or they, have a better understanding of whatever disease that they might be dealing with. So we put a lot of time and effort into education and making sure that the science isn't just staying within the hands of scientists. We have this saying that if research is conducted and published in only peer-reviewed scientific journals that only, a certain select people can really understand what they're saying, then it really probably isn't having much of an impact on public health, that we really need to get that research out so that it can be understood and used by everybody. And so that's a big part of what my office, the Office of Science Policy, Engagement, Education, and Communications does, is we're kind of the translators of that science and making sure that people can understand what it is that we're learning from this investment in science and how that's having an impact on their individual health, but also the public health.
And going back to the availability of this information at the NIH website, I think it is really important looking at comprehensive healthcare and having a patient-centered approach. We did have a guest last week, Pete Fronte, who is the CEO of Altura Research, and he was emphasizing the importance of research and how it helps us get better and also learn how to do things differently. When I think about the future of healthcare, having these opportunities available so that people, and the information available so that people can have conversations with their neighbors, have conversations with their families, have information to discuss with their providers, really tends to, in my mind, support us moving forward in a more efficient, effective healthcare delivery system. I know that we talked about the National Heart, Lung, and Blood Institute. Can you talk to me a little bit more about the impact that supported research has had on public health through that department?
Yes, happy to. I think one way to look at it is historically. We know today that Americans are living much longer and much healthier lives. If we look back, life expectancy in the 1900s was about 47 years. And that has grown to a current life expectancy of close to 80 years. I think it's 81 years for women and about 76 for men, if I remember, but on average about 78 to 80 years. That's a tremendous change in just a little over 100 years. And if we really look back on it, it's really sort of our greater understanding of public health and disease and research into that's kind of led that way. So, for example, in 1900, what were the leading causes of death? They were infectious diseases, pneumonia, the flu. We're hearing a lot about the flu this year, but in 1918, that pandemic flu killed more people than all of the wars that the United States has ever had. I mean, it was a tremendous number that these infectious diseases were taking in the early 20th century. If we look at what's happening today, it's the chronic diseases that are the leading causes of death. We've been able to develop effective approaches for dealing with infectious diseases and treating the flu, treating pneumonia and preventing the flu with vaccines, and dealing with infectious diseases through public health methods. So that things have transitioned. Now the leading causes of death are, number one, heart disease, number two, cancer, and number three, COPD, chronic lung disease. Mm-hmm. So we really have to figure out how to deal with these chronic diseases.
Yeah. We're going to take a quick break. I want to continue because I know that the history is fascinating, and I want you to continue this thought. We'll be right back.
Okay.
Hi there. Welcome back to today's Healthy Community. We have the great pleasure of welcoming Dr. Lucinda Miner, who's with the National Heart, Lung, and Blood Institute with the National Institute of Health. And we were in a conversation about the history of health in this country and how much it's changed in the life expectancy expectancy has changed over the last 100 years. You are starting to talk to us about transforming public health and a very important study, a longitudinal study that started quite some time ago that it apparently has been 3 generations or 4 generations. It's still going on. Can you tell us about the Framingham Heart Study?
Yes, thank you. Absolutely. As I was saying, we've really come to understand that the diseases we're dealing with today are chronic diseases. And so how have we come to understand those better? And one of the studies that's really contributed to that is the Framingham Heart Study, which was started back in 1948. In 1948, President Truman signed what's known as the National Heart Act. It established the National Heart Institute, which is the forerunner of the National Heart, Lung, and Blood Institute of today. And in that same legislation, they invested $500,000 to start what was called the Framingham Heart Study. And this was one of the very first long-term cohort studies where they identified a group of about 5,000 people living in Framingham, in Massachusetts at the time, and started following them over the years, looking at the various activities and diseases that they encountered as they aged. And what they found was that they identified several major causal risk factors for heart disease in following the progression of disease in these initial individuals as well as their children and grandchildren. And some of the major findings from the study have really changed the way we think about heart disease and cardiovascular disease today. This was the first study that identified cigarette smoking, for example, as being a major causal factor for coronary heart disease. In the 1960s, this study identified high blood pressure and high cholesterol as major risk factors. Prior to that time, we had no idea. In fact, back in 1945, when President Roosevelt died of a stroke, physicians had no idea what even caused that. They knew he had hypertension, but they never understood that there was a link between hypertension and stroke, and they certainly had no effective treatments for hypertension like we have today. And so it was the Framingham Heart Study, by following all of these individuals, was able to start identifying these various risk factors, which then enabled researchers to go in and start to understand what the basic biology behind this was, but also start to identify what kinds of things could you do to start ameliorating some of these risks and decrease the chances that you would develop coronary heart disease, heart attack, or stroke. So this long-term 70-year investment in this study has really led to just a wealth of information about cardiovascular disease. And in fact, it's estimated that it has saved about 1.5 million lives per year. We know that heart disease at its peak in about the mid-1968 to now, heart disease and deaths from heart disease has decreased about 71%. That's the good news. The bad news, it's still 1 in 4 deaths in the United States are due to heart disease. So while we've come a long way, still a long way to go.
And I think that the good work that's done at the National Institute of Health in regards to research and outreach also supports further research. For instance, when we look at studies and outcomes that you all may have from your research, it may prompt a pharmaceutical company or another research group to look at medications or wearables or other supports and things that patients might use to stay healthier. I think, go ahead.
That's right. Actually, we stimulate a lot of that research, a lot of the basic initial biological research, and a lot of the initial clinical trials, for example, for developing, medications to lower cholesterol or to deal with hypertension. All of those studies were actually started here. And then, adopted and taken by the pharmaceutical companies. So, there is a very important pipeline between the basic research and sort of the initial research that's developed at the NIH, and then it's taken and refined by the pharmaceutical companies.
And when you speak about 1 in 4 deaths in this country are due to heart disease, that's a whole lot of people. And I know in the U.S. we have something like 7.5 million women and over 9 million men in this country who suffer from coronary heart disease. In New Mexico alone, if I'm not mistaken, I think there's a little over maybe 110,000 people that have heart disease. And so
that's right.
What can we do about that? What are you thinking, Dr. Miner?
Well, fortunately, we touched a little bit upon, there's a lot of research has developed a lot of effective medications, for example, to lower your cholesterol or, to deal with hypertension. But actually, there's a lot of lifestyle changes that can also be very effective in lowering your risk for heart disease. Through the research from the Framingham Heart Study and others, I mentioned that we understand what the major risk factors for developing heart disease are. It's high blood pressure, high cholesterol, diabetes, smoking, being overweight, having a family history, age. There's a number of just healthier lifestyle changes that people can adopt that can have a major impact on preventing these diseases. So, for example, lowering sodium in your diet. Having a healthier diet, instead of reaching for the fries with that, maybe a small salad or fruits and vegetables. Those can have a major impact in lowering your cholesterol level and lowering your blood pressure, and then thus lowering your risk for disease. Another one that NHLBI, as you mentioned earlier on, this is Heart Month, and we've been doing a lot of outreach around physical activity. Increasing how much you move can be very beneficial in lowering your risk for heart disease. The current guidelines suggest that people should get about 150 minutes of physical activity a week, activity that gets your heart beating faster and leaves you a little breathless. That can have a tremendous impact. Actually, there are some studies that show that lowers your blood pressure more than most medications do.
Which makes sense because it is a muscle, and when we use our muscles, we tend to be healthier.
Exercise it. That's exactly right. So if you go to our website, nhlbi.nih.gov, we're inviting people to learn more about it, but also take a pledge with us to move more. In fact, the Surgeon General of the United States just did a short video pledge that he posted on Twitter and challenging others to move more for a healthier heart. And we're encouraging people around the country to join us in that pledge. You don't have to do this all at once. Small steps can really add up.
Literally.
If you can't do 30, exactly. If you can't do 30 minutes a day, we'll do 10 minutes 3 times a day. That can still have the same beneficial effects. It doesn't have to be walking, or it doesn't have to be going to the gym. You could go dancing. Anything that gets you moving and pumping is helpful. And
working in the garden and things like that. So the call to action for your organization for Heart Month is Move with Heart. Is that right?
That's right.
That's
Hashtag good. Move more with heart.
Oh, okay.
So, I encourage people to go out and take a little video of your house. We take a video of you pledging to move more and showing us what you're going to do. If you go to our website, you can see a lot of the videos that people have posted already. And it's really quite fun to see what people are doing, getting out there, walking their dogs or going dancing or playing basketball or riding their bikes. Lots of things we can do. And
I'll also add, too, on that line that there are a myriad of activities that can help one, even those folks who may have limited mobility, things like, or limited space, things like yoga. There's lots of videos online about how to do chair yoga, how to do yoga in your home, relaxation techniques. So I think that the information's out there, and I think one of the focuses of today's healthy community is to help people understand how to find that information and have information that they can then share and discuss with friends and relatives.
Yeah, and I encourage people. Really, our I'm not biased at all, right? But our website is a great resource. The Heart, Lung, and Blood Institute was one of the developers of what's called the DASH diet, the Dietary Approaches to Stop Hypertension. This has been ranked for a number of years as the best diet overall in lowering high blood pressure. And we actually have a lot of information on the diet on our website and healthy recipes and that sort of thing as well. All of this with the idea of trying to get people to, one, know about these resources, but start to use them as well. And, changing behavior is tough. Breaking habits is tough, but you don't have to do it all at once. Small steps towards these goals can really make a big difference.
Yeah, you're right. And a lot of these things, eating canned vegetables, for instance, was very common in the 40s, 50s, and 60s. And as we're moving now into a new place, we tend to grab more fresh fruits and vegetables. We're down to about 3.5 minutes here, 3 minutes on the show. And I want to talk briefly, I think we were going to touch on some information like health disparities and how different cultural groups and different geographic groups may have higher risk factors for heart disease, and what you think about that.
Right, yeah. We know from the research that, in particular, African Americans and Hispanics have higher rates of many of the risk factors for heart disease. So, for example, there's a higher prevalence of obesity, smoking, physical inactivity among African Americans and Hispanic men and women. And as a result, there's a higher prevalence of coronary heart disease in these groups as well. And so one of the things that our institute has been investing in a large amount of research dollars in is to look in particular at these groups and try to better understand the risk factors for heart disease. So we have a number of what we call cohort studies following people and looking at the prevalence of disease and the risk factors that can contribute to that disease. So we have something called the Jackson Heart Study that takes place in Jackson, Mississippi, that's focused on the African American population. We're just about to renew our Strong Heart Study. This is a study in Oklahoma, New Mexico, Arizona, and North Dakota, looking at the American Indian population, another group that is, severely impacted by heart disease. We also have the Hispanic Community Health Study that is in a number of locations around the country, and the study of Latinos, again, looking at heart disease and the risk factors for heart disease in these groups that are particularly impacted.
This is wonderful information. Thank you.
There's, again, a lot of information on our website around these particular studies and some of the results that we've found in these populations. So I encourage people to go to the website and look those up and see what we're doing. And, if possible, you might want to, if there's something close by or close to a family member, take part as a subject in these studies.
Thank you, Dr. Miner, for joining us on today's Healthy Community, and we'll talk to you in another episode about addiction.
Okay, sounds good. Thank you so much.
Bye-bye.